Neevodha is a combination multivitamin, mineral, and fatty acid product that is commonly used to treat or prevent vitamin deficiency, especially before, during, and after pregnancy. It contains important building blocks that are essential for the body and overall good health. In addition to vitamins and minerals, Neevodha also includes iron and folic acid, which is particularly important for women of childbearing age to prevent spinal cord defects in developing babies. It is recommended to maintain adequate levels of folic acid either through diet or supplements. When taking Neevodha, it is usually recommended to take it orally, once or twice a day as prescribed by your doctor. Follow the instructions on the product packaging or as directed by your doctor. If you are taking the powdered form, mix it in water before swallowing. If it is the delayed release form, do not crush or chew it. It is best taken on an empty stomach, 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take it with food. Do not take antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as it may decrease its effectiveness. It is also advised not to lie down for at least 10 minutes after taking Neevodha. Remember to take it regularly at the same times each day to get the most benefit from it. If you experience constipation, diarrhea, or an upset stomach while taking Neevodha, don't worry. These effects are usually temporary and may go away as your body gets used to the medication. However, if these effects persist or worsen, make sure to inform your doctor or pharmacist. It's important to note that Neevodha may cause your stools to turn black, but this is not harmful. Your doctor has prescribed this medication because they believe that the benefits outweigh the potential side effects. Many people who use Neevodha do not experience serious side effects, but if you notice any easy bleeding or bruising, it's essential to contact your doctor right away. Although it's rare, a very serious allergic reaction to Neevodha can occur. Seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects. If you experience any other effects that are not mentioned here, make sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can also call your doctor for medical advice or report side effects to Health Canada. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years, so it's important to keep Neevodha out of reach of children. If overdose does occur, it's crucial to seek medical help immediately or call a poison control center. Before using Neevodha, make sure to inform your doctor or pharmacist if you have any allergies to its ingredients, fish, soy, or peanuts. It's also important to let them know about your medical history, including any iron overload disorder, alcohol use, liver or stomach/intestinal problems, vitamin B12 deficiency, or bleeding disorders. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and supplements you are taking. Neevodha is safe to use during pregnancy when used as directed, but it's important to consult your doctor before using it while breastfeeding. When taking Neevodha, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Certain products that may interact with Neevodha include chloramphenicol, certain anti-seizure drugs, such as phenytoin and methyldopa. Additionally, Neevodha can decrease the absorption of other drugs such as bisphosphonates, including alendronate, levodopa, penicillamine, quinolone antibiotics, such as ciprofloxacin, levofloxacin, thyroid medications, such as levothyroxine, and tetracycline antibiotics, such as doxycycline, minocycline. It's recommended to separate your doses of these medications as far as possible from your doses of Neevodha. It's best to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If someone has taken too much Neevodha and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of Neevodha overdose may include stomach pain, nausea, vomiting, and diarrhea. Remember, it's crucial to take Neevodha as directed and not exceed the recommended dosage. Always consult with a healthcare professional before starting any new medication. When taking Neevodha, it is important to remember not to share this medication with others. Your doctor may also recommend lab or medical tests, such as complete blood count or checking your vitamin B12 levels, while you are taking Neevodha. Be sure to keep all medical and lab appointments and consult your doctor for more details. Some brands of prenatal vitamins also contain additional ingredients such as calcium, zinc, iodine, or docusate. If you have any questions about the ingredients in your specific brand, it's important to consult your doctor or pharmacist for clarification. It's important to note that Neevodha is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you forget to take a dose, take it as soon as you remember. If it's almost time for the next dose, just skip the missed one. Take the next dose at your regular time. Do not take double the dose to make up for the missed one. When storing Neevodha, it's important to keep it at room temperature, away from light and moisture. Avoid keeping it in the bathroom, and always store it out of reach of children and pets. If you no longer need Neevodha or if it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of Neevodha. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.